Hey everyone, welcome to the main event. My name is Joe Tillman, and today is Wednesday, May 3rd, 2023. Thank you for joining me. I think it's going to be a good show. I got some things to talk about, but before I do, I'll introduce myself if you don't know who I am and what I'm doing sitting behind this microphone. Like I said, my name is Joe Tillman, and I've been in the hair transplant industry working at a very high level with lots of clinics worldwide for 20 years. And beyond that, I've actually been a hair transplant repair patient for nearly 30 years, where I got my start in the industry after I got my first repair surgery 9 years after my second bad surgery, and got fascinated by the industry and started working with top clinics at that time. And since then, it's been a hell of a wild ride. I've traveled the world, visited clinics where I review them, and I let you know that I think that I'll let you know if I think that they are worth considering. I have been to clinics before where I get there and I realize I shouldn't have come. It's happened more than once. And so I've had the question many times, why don't you talk about those clinics? Well, the reason why I don't talk about those clinics is because they reached out to me in good faith, wanted my review in good faith, and just because they may not have met my standards doesn't mean that they're bad clinics. It's just, they have happy patients, but I'm not out to ruin one's reputation. And if I came back from a visit and I actually put out a video talking about why a clinic failed to meet my standards or pass my review, that clinic wouldn't be doing so good. So I'm not out to destroy people. I'm out to share whom I think is worth considering, and the only way to do that is through proper reviews. So I try to be fair. I try to be I try to be fair about things and not compromise the trust that a clinic puts in me for me to come into their clinic. They open the doors for me, and I'm not gonna poo on them because of it. So that's why I don't talk about bad clinics that I've reviewed or that I've been to. So yeah, so today is a big day, and we'll get into that. Before I do, it is a toll-free number for you to call in. The number is 833-563-4247. Let me get that up on the screen. Where we go? Right. No, not there. There we go. Number is right here, down in the corner. That's 833-563-4247, toll-free in North America, and any calling app that you can use to call worldwide, you can call me too, including Skype or whatever else you might be using. But today is... it's interesting because a new hair loss product has been released, and you've probably heard about this. And no, it's not Vertipoin, whatever it's called. Can't remember the name of it. It's called CosmeRNA, and I don't know a whole lot about this. I did a little bit of looking into it before the show, among other things that I'm doing, and I looked at the ingredients aside from the actual inhibitor. The ingredients read like a skin conditioner. I don't know a whole lot about skin conditioners, but I looked like they talk about the ingredient list, and you can actually find this on hairlosscure2020.com, which is a great supporter of this YouTube channel. That would be the hair transplant channel on YouTube. And he's been on top of this. Like he's on top of all of the non-surgical options that are coming down the pike, treatments like from Stemson Therapeutics and from, God, I can't think of other names. But yeah, including these guys. Now, this is a South Korean company, and they decided to not go through the traditional review process that would be the FDA. And in fact, they didn't even release it in North America to start. They started off in Europe, and they went through the process of being okayed as a cosmeceutical, which is not a medication. They even say on their website that, I think they say this, that they're not a medical treatment. And they're just being clear. Like, they have to cross their T's and dot their I's and make sure that they're not making false claims, which is what anyone would want to do. But they're going the route of cosmetics, and that's smart. They're still able to make their claims about fighting hair loss, but they don't go through the normal channels, which are very expensive. Like that's why. I'm sure that's one reason why they're going the route that they're going, is because it's not as expensive as it would be had they tried to apply for an actual medical clearance. And latest reports is that it's going to be costing in the realm of $300 for a 3-month supply. Now, I looked at this, and the way that they're suggesting the application, I believe it's once every 2 weeks. I have to review it, but once every 2 weeks. Sorry, once a week. I forgot. Is it once a week and then once every 2 weeks once it stabilizes? Now I got to look it up. But while I'm doing that, give me a call, people. Let's talk about this. Like, if you have opinions on this, I want to hear it. I want to know what you think about CosmeRNA. And here's someone calling right now. I think I know who this is. Hey, you're on the main event. What's your name? Where are you calling from? Hello?
Hey there, can you hear me?
I can hear you. What's your name? Where are you calling from?
Hey, so I was just wondering, given the price point, it's given the price point, do you see people jumping on it, someone who's at a Norwood 3 or a Norwood 4? And it says, so to answer your question, it's once every 2 weeks, and then going forward from month 4, I think it's once per month. But the cost is way too high for someone to consider this. I see a few people jumping the gun and sort of ordering it, but I'm still a little skeptical. So is
this our new friend of the show, Norwood? Wait, what was your name? Who is this? I asked who you are.
Yeah, I'm Albert.
Hello? Hello? Are you there? Just lost him. Okay. Well, that happens. Let's look through this. So, how it works. Learn more. Okay. So on the website, it's talking about antigen, catagen, telogen, blah blah blah, and the caller. I think that was Norwood Shaman. That's it. That was it. Norwood Shaman. He was saying that he thinks it's too expensive, but if it's $300 for a 3-month supply, I think that's reasonable. And I saw that Hair Loss Cure 2020 on his blog was saying that it's higher than expected, and that's fine. But for $300, it's basically $100 a month. Like, if it does what it's supposed to do, that's a bargain. Because if you're going to be ordering Proscar or Propecia, it'll be about the same, give or take. So it looks like they're pricing it in the realm of what one would want to pay, or what one would pay, whether they wanted to or not, for prescription medication. Hey, you're on the main event. What's your name and where are you calling from?
Hi, I'm Unitas. I'm from New York.
Hey, how you doing from New York? What's your name?
Unitas.
Unitas.
Yep.
Interesting name. Nice to hear from you. What can I help you with?
Yeah, I just wanted to say that I think, because of the price, some people will probably just wait the 6 months or a year and see other people's results before they make a commitment to it.
I agree. I think that's wise, actually. I don't think it's a good idea to, like, it's just me. Like, I'm interested in this, but I I'm not going to jump on the bandwagon from day one. I think that it makes a lot of sense to. I look at this as like a software update for your operating system. Like I never jump on the first day to upgrade to update my operating system. I give it a week, sometimes a month to update, unless it's like a major security update. But I'll give it a few weeks just to see if there are any bugs, or if there or what those bugs are. If there's something that would affect me, and if they're easily dealt with. So I think that's an absolute approach to take on this product. Let other people be the guinea pigs, because that's essentially what they are. Like, obviously the companies had their own studies on this. I think
most people agree that the research, they didn't really give us enough information, and I think more people wanted to see like a 1 year or 2 year study. They mostly did like 6 months,
Yeah.
It's not really enough.
Yeah.
You're going to be committed to it for life if it's working. So you want to see way more than 6 months,
Right. And this isn't a typical, topical where you've got an alcohol-based delivery system to get it into the scalp. I mean, this is on a different level, and so you want to make sure that it is going to be safe.
Yeah.
And
they say it's safe, but obviously nobody knows for sure until somebody uses it.
Yeah, of course. And so, I think it's a very reasonable approach. I agree with you. What have you done any research into the mechanisms of delivery? Have you done any research on the product itself?
Yeah, essentially what it basically does is like a type of new biotechnology, which is kind of like silences the, instead of DNA, there's something called RNA, which kind of has its functions, and it's supposed to suppress a certain function, which it prevents it from producing androgens. And I believe androgens are what bind to DHT, which is what causes androgenic alopecia.
Yeah. It I was reading that, and just full disclosure, like I don't read a lot about this kind of stuff, because it's never, just to the people watching and listening, I never dive into this stuff because it's almost always meaningless, because nothing ever comes to product. This is an exception, right? Like now it's finally out, it's available. So I am going to dive into this a bit more. I dove into it some before the show, but I appreciate your opinion on that. I think that's very sage advice to wait, give it time.
Of course, some people don't have as much time, so they're probably going to rush out to get it, and that's understandable.
Now, are you currently taking any medication yourself?
No, but I kind of just got into learning about this stuff, so I haven't really committed to anything yet. Yeah.
How long have you been dealing with hair loss? How old are you?
I'm 29, and it's not terrible, so I'm not like, in a complete, I don't feel like I could rush into anything that I'm not sure of.
Have you considered anything to take in the, while you're in your research phase?
Probably not finasteride, but, maybe when I'm like 35, I'll probably get a transplant, just because why not, And I heard that the later you get it, the more likely it is to stay with you. You don't have to like worry as much about managing it.
I'd be interested to know why you think that. What's your logic behind that, or is this just what you read?
Well, yeah, it's just what I read. Basically, like apparently your DHT is higher when you're in your 20s, and then when you're past like 30, 35, it's like lower. So I don't know. I read a lot of random people who say, "Yeah, I got mine at 35 or 40," and it stayed with me. So that kind of, I guess, like I'm happy that I got to this point.
It's interesting. It's interesting that you're saying that, because it's not so much the amount of DHT, or rather the amount of testosterone in your body that's being converted into DHT. It's the sensitivity of the receptors on the follicles. Okay. That's the issue. It's not the amount of DHT. It's the it is, but it has to do with the sensitivity.
Generally.
So
yeah, sorry, I was gonna.
So when you're and just some facts for you, because I want to make sure that you're armed with facts as opposed to reading what people think on the internet. the ability for your transplant to stay or to remain, I think that's the words you're talking about, has nothing to do with your age. Okay.
Oh, okay.
The conventional wisdom is that your donor hair is supposed to be resistant to DHT for life.
Yeah, more resistant.
More resistant. Yeah, more.
Maybe
That's very key, because I was going to say it's actually not that for all patients. Some patients it can be, but there are cases that I've seen personally where transplanted hair has thinned with time along with the donor area. So it's not that common, but it's not unheard of. So it is important to take medication to strengthen your native hair on top of your scalp and for your donor region. But your approach to, I'm 29 now, not taking anything. Maybe I'll get a hair transplant at 35 because why not? I think that you are most likely setting yourself up for disappointment, because the transplant does, the age doesn't matter as far as its efficacy, but you're going to lose. Why lose more hair for the next 6 years and then get a transplant when you can actually save your hair now and not get a transplant?
Yeah. I mean, one of my issues with finasteride, I did take, what's the other thing, saw palmetto, and I got some side effects. So I assumed that I would probably get side effects from finasteride because it's like, stronger version of that, So I was just afraid to take it. And, I guess that was basically my thinking.
Fair enough. No, I completely understand that. There's two things I'll throw your way. First off, I recommend people that are concerned or even have experienced side effects to maybe consider titration up to an effective routine where you take a dose once a week for a month and see how you deal with it. And then the second month, take it twice a week, Mondays and Thursdays.
So you think it can be effective even a low dose, or you're saying you build tolerance to it?
Well, it's not so much building a tolerance, but it's just finding that threshold of intake that you can handle, and then staying steady at that threshold to give yourself the best fighting chance possible. So as you build up your routine, every month you up it from once, twice, 3 times, 4 times a week, 5 times a week, whatever. Once you get to that point where, or if you get to that point where it's like, well, I think I'm experiencing side effects, you got 2 choices. You can push through for them and give it time for the side effects to dissipate, which is very common in people that do have side effects, or dial it back to the previous month's routine and hold steady to see how that works out for you. I'm not a doctor, but I've recommended this approach to a lot of people, and I've not had a single person come back and say, that didn't work. I think it's really effective, and my own observations over the years have shown it's effective, and it may work for you as well.
Yeah, another fear I have with it is that, I heard that if you just stop taking it for a year, you kind of lose everything you would have lost anyways. So
that's exactly right. Because if you didn't,
I'm fighting a losing battle,
If you didn't, then guess what finasteride would be if you didn't lose everything that you hung on to? It would be a cure. Right? It's the same thing as brushing your teeth. It's like you're maintaining your teeth with toothpaste. So if you stop brushing your teeth for a couple of years, your teeth are going to fall out.
Yeah, but the difference is that all the years that you brushed your teeth, you still kind of gain something from it. The thing with finasteride is that, based on what I've read, let's say you take it for 10 years. If you stop taking it for a year, it's as if all those 10 years are deleted. You know what I mean?
Well, my example holds steady. It's the same difference. Not to mention, studies were showing that when you're taking finasteride, or in a study in Japan, after 10 years, hair counts continued to increase with finasteride. So that's another thing to consider. I'm not here to try to talk you into it. I just want to make sure you understand the facts moving forward, where that analogy of losing everything that you held on to, if that didn't happen, then it would be a cure. And that's the same. It's the same thing with. It'll be the same thing with.
I think CosmeRNA is going to be the same thing anyway.
It'll be the same thing with that. It's the same thing with minoxidil. It's the same thing with PRP. It's the same thing with anything that you're using to fight hair loss, and you're having some sort of success. Once you stop using it, it's all gone. It disappears over time faster than had you not taken it to begin with.
Transplant the only real solution then?
Well, a transplant's a solution for what you've already lost. It's not a solution for future loss. It doesn't prevent the loss of hair that you have now.
I guess you could keep doing another one.
Well, you can do more. In fact, you'll most likely do more anyway, even if you're on medication. But the point is to avoid surgery because it's not guaranteed. If you have excuse me, if you have surgery, there's no guarantee it's going to work out. There's no guarantee you'll be happy. It doesn't matter where you go. It doesn't matter if you go to a doctor I work with. I work with 15 different doctors. If you go to one of them, it could still turn out bad. They're human, I mean, it's not.
But I don't know. Is that a high likelihood that it'll turn out bad though? Pretty sure most of them.
It's a high likelihood on clinics that maybe. I mean, that's a whole discussion, but it's not a high likelihood with a good clinic. But the fact that there is any likelihood at all should give you pause. Because once you get cut, you're cut. That's what my colleague Spencer Coburn always says.
I mean, I kind of see every solution as risky, anyways. I feel like if anything, transplant is less risky.
Well, it's not. It's more risky. Take it from me. I've had 2 bad hair transplants, and let me tell you.
Oh, really?
Let me tell you. When you have a bad hair transplant, everything else becomes secondary. Because if you got bad grafting, if you got multi hairs in your hairline, or if it's badly angled in bad directions, or if you have bad scarring, or if you have a depleted donor area after one shot, because that can happen, then you would wish that you had side effects with finasteride, but it worked to where you didn't have surgery. It's one of the worst things that you can go through. And please people that say that I'm comparing it to cancer and things like that. No, I'm not comparing it to cancer.
Yeah, I know what you mean. And as in the context of the hair loss.
Yeah, exactly. In the context of hair loss, it is the absolute worst thing you can go through because you think it's bad just losing hair. Wait till you're losing hair and it looks like you tried to do something about it and failed miserably.
Oh, that's what it looks like. Yeah.
Yeah.
So you mean you're saying that when you got one of your angles, they angled it wrong? What do they do for that to happen? What does the surgeon do wrong for the angles to come out wrong?
It has to do with honestly. Sometimes I have to think about it because it's just obvious to me, but what they're doing is they're not coming at it with an aesthetic sense that is reasonable. They don't understand the aesthetics. They just start making incisions and start placing the hairs in. They're not considering how many hairs are in the graft. Yeah. They're not considering the characteristics of the hair. They're not considering the curvature of the hair. If we're going to get down to the details, they're not considering the flow of they're not considering the directional flow of hair as it sits on the scalp when the patient sits down. Because that's what you're trying to do. You're trying to match the angle and direction of the general flow of the patient's hair. Because if you look at someone's hair, like if you shave your own head down, you'll notice that the hairs are exiting in very specific angles, and it's a pattern on your scalp. So they have to match that pattern.
Yeah.
Does that make sense?
What's the relevance of multi-hair grafts? You said multi-hair.
Oops. Sorry. Can you repeat that?
What is the relevance of a multi-hair graft? Why does that matter again?
Well, if you have multi-hair grafts in your hairline, then it stands out because that's not the way it happens in nature. If you look if you look at anyone walking on the street that has a good hairline, and you're able to say, "Hey, dude, can I have a look at your hairline?" and you pull out a magnifying glass and you start looking at it, you'd notice that almost all the hairs, are finer and single hair follicles sticking out of the very front. Everyone
Yeah.
in nature, you can see some doubles, but they don't make up anywhere near enough of a ratio to be obvious when you're just looking at the hairline. It's just a small handful at most, relatively speaking. But the hairline itself should be singles, and they should be exiting at a specific angle and direction that matches the rest of the scalp. In other words, it needs to look like it wasn't put there by a surgeon. It needs to look like it was put there by Mother Nature. That's the whole point.
Yeah.
Make sense?
Yeah, I see what you mean.
All right. Excellent. Well, think about what I said. If you got more questions, I'm really glad you called. I invite you to call back. Let me ask you this. How'd you find the show? Is this the first time you've watched the show?
Well, I just YouTubed CosmeRNA just to see what, if anybody was talking about it. And then I saw that you were scheduling a live thing, so I just subbed to it.
Right on. Well, I appreciate you tuning in. I appreciate you calling. Do me a favor, hit the like button on this video if you thought that my info was valuable, and hit the subscribe button. I got a lot of stuff coming up, okay?
All right.
All right. I appreciate your call. Thank you very much.
No problem.
Bye-bye. Toll free 1-833-563-4247. That was a great call from New York. I appreciate his call and invite any of you to give me a call. Let's talk about CosmeRNA. What do you think about it? Are you excited by it? Have you done research into it and you've got some opinions about its efficacy? Do you think it's going to be just another snake oil? Do you think that there's some legitimacy to what they're claiming, to what the hype is? Because there's some hype about this. Let me know. Let me know your opinions on this. 833-563-4247. Let's go to the room, and people, hit me up with some likes. I appreciate likes on this video. This is a unique one. I don't normally talk about this kind of thing. I did talk about it earlier, a couple weeks ago, where, was it even on this show or was it for Bald Truth? I can't remember. But I was talking about how it's not available yet. It was supposed to be available in, I think the store was going to open, or availability was going to be in March, or maybe it was early April, and it didn't come out until today. So, here we are. We're finally able to talk about it. Let's see. Thank you for the likes. I appreciate that. What we got here? Looking for the questions. Sounds like the caller's wearing a COVID mask. No, that's not good. Just jumped in to listen. Is CosmeRNA really promising more than Fin and Minox or Minox? Minox? I don't know if they're promising more, but at the very least, I think they're suggesting it'll be just as effective. Let's see. I recently got a transplant due to mix of traction and genetic hair loss. Oh, traction. Okay. Never used medication. Should I start with this new medication to maintain rest of hair? I'm 26 and Norwood 3. Well, you heard the conversation with that last caller. And sorry, the user is, it's always day one. You guys have the most innovative usernames. And I like that, by the way. It's always the first day for something. I'm assuming that's what it means. You heard what we're talking about. It's like I'm not jumping into it. I never jump into anything like this, or like I was saying before, like software updates and stuff. I let other people be the guinea pigs. But your situation is a combination of DHT and traction alopecia. Are you male or female? And have you been pulling your hair back into a tight bun or a tail for many years? Because that's what can happen. I'd like to know more. Give me a call. Let's talk about it. 833-563-4247. Let's see here. Actual questions. Okay, HLC 2020, Sackball Finneman have clinical trials and many, many studies behind them. CosmeRNA has no trials and just one study. That's true. But we are all impatient, so excited about this cosmeceutical route. Yeah, exactly. Mike Pedroza says, Joe, I just had PRP and was able to get a prescription for oral minoxidil. They said I may have some shedding when I start using it. Yeah. Who prescribed that? I'd like to know. It'd be interesting. I'm sure the group would like to know. But yeah, I've been saying this for years. Anytime you introduce a new agent that will be affecting your growth cycle, it can cause a shed because it's resetting your growth cycle. And, just like with surgery, just like with finasteride, adding something to your routine can initiate, say, 5 steps backward before you take, 1 step forward, and then continue to take steps forward as the improvements accumulate and build. So I hope that makes sense. But yeah, that's probably the best caveat that anyone could give you when they're, or not caveat, but you could almost call it a warning when they give you a medication for hair loss, is it could induce a temporary early shed. So yeah, that's good. Let's see. Mass awakening I call BS until we can see real world results. I agree. I think that, I think that we need to give it a chance, because they did make it this far to where they can, say that they're an actual product, that it's available. This isn't something that you're ordering, off the dark web and mixing in your tub, like some of these other treatments that people are taking at home. See, Hampton Hudson says, Joe, in one of your episodes, you stated that the left side of a transplanted hairline comes in slower than the right side. Any idea of mechanism behind this? No. In some cases, it's because one technician on one side is screwing up and the other one isn't, because you usually have one technician on one side from the other. But barring that, it just seems like different parts of the scalp come in at different times. There's no rhyme or reason to it. It's not like a blood flow difference, or it might be, but it's the same. In my view, it's the same reason why different areas of the scalp come in at different rates, like the mid scalp. The mid scalp might not come in as fast as the hairline, or vice versa. The crown typically takes a bit longer, but not always. I think it's just roll of the dice. Let's see. We're gonna see. Need thousands of people. Yeah, FSK says need thousands of people to try to get a true reflection of its worth. I agree. Broda160. I'm sure that dermatologists in Newport Beach is selling CosmeRNA. Is it something that's available directly from doctors? They got an online store. So why would anyone want to buy it directly from a doctor? Mike Pedroza, I don't think I want to screw with it. I know my hair looks really good. I don't think I want to try it now. Fair enough. I think that's actually a good idea, because it goes along the lines of what I've always said about introducing multiple treatments at once. You don't know what's working. Your PRP that you just got might be all you need. And if you're taking oral minoxidil and it's the PRP that's working, you won't know if the oral minoxidil has anything to do with it, and you'll be afraid to stop it, or you should be afraid to stop it, because maybe it is. But if it's the oral minoxidil that's working, how do you know that the PRP is doing anything? You don't. That's the challenge. That's the danger. Is it really danger? That's the danger of starting multiple treatments at once, throwing the kitchen sink at the problem. You don't know what's actually working and what's not. So, how hard is it to achieve original density in the hairline? I consider that to be a moot question, because you don't need original density in the hairline. That's a surgical question. Their PRP appears to be legit. That's good. I don't think you mentioned where you went. Pick up the phone, man. Call me. You got some great things to say. Broadabond60 says, reference to the Bald Truth caller last Friday. Okay. Got it. Let's see. Mike says, I would call, but I'm at the bar in the airport on my way home. Well, in that case, FaceTime me. I will see what's going on in the bar. Lars Ride Jeppesen, dutasteride and oral minoxidil gave me a great result. Thickened my hair a lot. Good for you. Good for you. Did you start taking them both at the same time? Do you know which one's doing what? All right. So, yeah, give me a call, people. Like, we've got We got a great subject here. I want you to call me and tell me why or why not you think this is going to be worth considering. I want to hear your opinions, not just in the chat room. Like, I appreciate everyone in the chat room. Like, you have to be subscribed for at least 10 minutes to be able to participate. So I know all these people are subscribers to my channel, and I appreciate every one of you. But this is a call-in show. I want to hear from you guys. 833-563-4247, toll-free in North America and accessible through any call app worldwide. Let's talk about this. Give me your opinion on this. And by the way, it's confirmed for tomorrow, before we continue with this subject, it's confirmed for tomorrow. I've got Dr. Özlem Bisher from Istanbul. She will be here live to answer your questions. I think it's a great opportunity to get a feel for this doctor. And that's why I'm bringing these doctors on for these Q&A sessions. I'm not doing an interview where I'm asking not loaded questions, but scripted questions that gives the doctor an opportunity to script an answer. I don't believe in that. Like, it makes sense in some situations, but I love the live aspect. I love being able to have the ability to put doctors and the public together so you can ask legit questions on the spot. And so I'm looking forward to this. Like, I've had some great guests so far, and I think this is going to be another good one. And tomorrow, if you tune in, I want you to really show your support to her, because she's getting up at 1 a.m. or she's getting up. The show will be 1 a.m. for her, and she said that she'll dedicate an hour to the broadcast. That's more than anyone could ever ask for. I'm very gracious to her. Thankful to her for offering to do that. So tune in and support the show. FSK, I wouldn't touch it until literally Spencer and Joe say it's the real deal. Fair enough. Milk Drinker, my opinion of CosmeRNA is I won't believe it until I see results, and even then I'll be skeptical. I appreciate that. I do. Pick up the phone and tell me this. Let's talk about it. Who else? Dutasteride completely stopped my hair loss. Minoxidil thickened. That's Lars Rye Jeppesen. That's good. Glad to hear that. HLC 2020, you can also give me a call. Give me your... I actually like your opinion on this. We've not chatted about this, so I would like your take on what you think this is going to do, if anything. 833-563-4247. Let me know what you think, buddy. Give me a call. In the meantime, let's see. We got some good comments. No need to do any further research on it. These guys are better connected. Oh, you're talking about me and Spencer. Yeah. No, I appreciate that, FSK. And I got to say, though, in the case of this particular product, I'm not connected on this. And I don't think Spencer is. I don't think he knows anything like the people putting out. They're in South Korea. I will see if I can reach out to them and get them to come on the show. What do you guys think of that? If I get one of the representatives from this company to call in, or not to call in, but to be on camera answering your questions. I think that would be valuable. Maybe I can see if I can get that to happen. Milk Drinker, Joe, I'll send in photos of my case and call in. If you move the show back an hour, how about that? LOL. Yeah, LOL. I'm not moving the show back. Let's see, it's quite late to latte here. That's funny. But you're up now. Like, I don't understand what the difference is. Anyway, HLC 2020, I'm in a Starbucks. My best case hope is it's as good as finasteride, but different mechanism, so good. Yeah, I get it. Milk Drinker, late to call. Do you have kids you're going to wake up or something? Legit question. Like, you're in the chat room every day, which I appreciate. I'm glad you're here. But why can't you call? It doesn't make any sense. Chris, hey, Chris. Why real doctors from Turkey don't fight with that kind of cheaters? I don't know what you're talking about. Anyway, okay. So no one else has any opinions on CosmeRNA that you want to call in and talk about. That's interesting. Okay. Well, you can call about anything. The last caller, we segued from CosmeRNA into his own situation, dealing with hair loss, afraid of finasteride, kind of, which I understand. And I feel like his approach to surgery, unfortunately, was indicative of how a lot of people look at surgery. He literally said, doing surgery at 35 because why not? Well, the why not is because you might get screwed up. And I hope I got through to him. What do you guys think? Did I get through to him? Or do you think it was effective to say that a bad outcome can be the worst thing that a person with hair loss would have to deal with? I think so. What do you guys think? Mass Awakening. I've been on topical Fin for 6 months. 0.005%. I went through a strange skin peeling phase for about 2 weeks. Maybe it was sebum. Now my scalp feels healthier, and I believe I have experienced some thickening of existing hair. That first thing, never heard of that. Second thing, good for you. Yeah. FSK, but by the time it's good enough, you'd be better connected. Oh, okay. Yeah. No transplant is better than a bad transplant. Huh? No transplant is better than a bad transplant? Oh, got it. Okay, now I understand. Not having a transplant is better than having a bad transplant. Yes, I agree. That makes perfect sense. 833-563-4247. Toll free, North America. Sergey in the chat room says, what's the mechanism of CosmeRNA? How exactly does it work? The RNA factor in the name, once it's absorbed, it helps to suppress the sensitivity of the receptors to DHT. If I understood that correctly, I need to skim over it again. But yeah, it's not preventing the formation of dihydrotestosterone. It's reducing the sensitivity to dihydrotestosterone. I think that's the way it works. You can correct me in the chat room if you guys can, but I think that's it. 833-563-4247. I am going to shut down in the next few minutes if I don't get any calls. I love talking to you guys. That's why I'm here. But if you want to talk back, that's fine. I got stuff to do. Got a lot of stuff to do, actually. I have a meeting to go to at 6:30 that I really don't want to go to because it's such a pain in the butt. But I got some videos I'm working on. 2 of them from clinics that I work with that I think will be impressive. I think that you'll enjoy. I think you'll be impressed with what I'm putting into these videos. I'm also gathering my thoughts and my and the details I want for another video. It will be another hair transplant class video where I'm going to be talking about MSM, the supplement that you can get at any drugstore, grocery store, in the vitamin section, and what it means for hair quality, hair loss. Nick Lewis, what's the number? The number is toll free. It's 833-563-4247, just like it says in the corner of your screen. Yeah, I appreciate that. Give me a call. Let's see. So at best, it would go hand in hand with Fin, not on its own. Maybe. I mean, lots of people take finasteride on its own. I do, and it works fine. So it might be something to enhance finasteride. It might be part of the new big 4, pardon the yawn. You know, people talk about the big 3, which is different to different people. But sometimes it's minoxidil, finasteride, and derma rolling. Sometimes it's minoxidil, finasteride, and saw palmetto. Sometimes it's finasteride, minoxidil, and ketoconazole. That's a new one. And no, I did not employ AI for the thumbnail. I made that on my own. In fact, it was just a screenshot from CosmeRNA's website. I like the color, And in Photoshop, I copied the color for my background, layered, blended, and that's what you get. All right, we got a call. Hey, you're on the main event. What's your name and where are you calling from?
Hey, this is Nick.
Hello, Nick.
I'm the gentleman that just asked for your phone number.
Yeah. How you doing, buddy? Thanks for calling.
Hey, what's going on? What's going on, man? Stay about 1 second.
Milk Drinker says in the chat room, he says the big three are Propecia, Proscar, and finasteride. They're the same thing.
Yeah, so
anyway.
I'm a big advocate. Yeah, I'm a big advocate of maintenance. You know, I started my hair loss journey around like 28.
Mm-hmm.
You know, I did
How old are you now?
finasteride. 39.
Okay.
I'm about to be 39. I'll be 39 in May.
Got it.
So,
happy birthday.
yeah, I appreciate it, man. So I went in kind of like the gentleman you just talked to that didn't know much about hair treatment. I went into this place. I was like, oh man, I'm starting to see a little bit of hair loss in my front. You know, I want to do a hair transplant. They're like, oh, we don't think, they were actually good to me. And they're like, oh, I don't think you're recipient. Let's do PRP instead and laser treatment.
Mm-hmm.
So I did that, got on finasteride, did that for about 6 years. I started to see the effects wear off like a lot of people do.
Mm-hmm.
And then I started bringing in dutasteride. I do that twice a week now, and I've maintained pretty well.
Mm-hmm.
I recently had my second hair transplant with, I just to go back a little bit, I had a hair transplant about 4 years ago, just a small one, like 700 FUE, very minimal.
Okay.
Just to do the coverage in the front. And I recently had another one, actually with Daniel Lee, who's under Mr. Anderson.
Yeah, over Dr. Anderson's. Yeah, got it.
Yep. So actually I had one with him recently. So I was just curious what you think, you know, how is this applied? Is it a topical like Rogaine?
It's a topical. I don't know the consistency of it. I don't know if it's a cream or if it's a liquid of some sort, if it's thick or thin. I was looking at the application instructions, and they're suggesting that you comb it through your hair or comb it onto your scalp, which is interesting. Excuse me, but yeah, it's a topical, and the idea.
Okay, so I'd assume you'd apply it with a dropper, just like you would with the.
It looks like It looks like some sort of dropper. Yeah, I'm not sure exactly. Like I said, the consistency of it, but it does look like some sort of dropper or a very specialized application device that pushes it through a small opening. So maybe not a dropper.
Sure.
Yeah.
I guess. And I saw this is very new. Is this something you can get in the United States, or is it only in Europe?
It's a good question. I don't know. I mean, if we go, I was like when I went to the website, it says, do I want to stay? Let's see. Do I want to go to the Canada store? I think is what it said. Let me just double check this.
Yeah, I saw somebody looking for it in Switzerland, and then like somebody, I just didn't see anybody pushing it. In the United States, like, is it something you could? Could I go to my doctor and be like, "Hey, I want to try this"? You know, can I get it?
Well, it's not prescription. It's considered to be what's known as a cosmeceutical, which is like just a cosmetic, and you can order it directly from them. You don't need to order it from a doctor. You don't need a prescription. I'm on their website right now, and when you click on shop, it says it's 300 euros. And let's see here. Let's go.
What would that be in U.S. dollars?
Not much more. The dollar to euro is pretty close right now. Yeah.
So it's somewhat expensive then. So it's like $300.
Well, let's see.
Per event.
Let's see. So the conversion rate right now, if we were to look, I just screwed up because this cable's in the way. xe.com. Yeah. So if I go into the conversion here, it's 300. Convert, it is 332 US bucks. Now here's the thing. That's for a 3-month supply, which
okay, so it's actually not that bad.
No, it's not that bad. When you compare it to the cost of prescription medications like Propecia or Proscar, that's about depending where you are, that's about the same. So
okay, I didn't realize that was for a 3-month supply. I was thinking like 1 month.
Yeah, and it looks like you can order it anywhere. It's autofilling, like, because I'm in Canada. It's showing, it ships to Canada. No warnings.
Is it FDA approved?
No, that's why it's considered to be a cosmetic. Cosmetics don't go through FDA approval. The guidelines and the restrictions are much more relaxed when it comes to cosmetics. You still have to have some safety profiles, but nothing remotely like you do when you apply for FDA clearance. And it's a lot more expensive too. It's millions and millions of dollars to get that FDA seal because it just costs a lot. So this is how people bypass the FDA. They go the cosmetics route. There's another one, latanoprost, which is for thickening eyebrows. People have been trying to use that to thicken their hair as well. And it's not a prescription medication, and it's a derivative of a glaucoma treatment that is a prescription, but it's applied to your eyebrows or eyelashes to thicken them. So, and I could be wrong about that, but I'm pretty sure that's pretty accurate. So people in the chat room can correct me if I am wrong, and I'm sure you will. But yeah, so it's simply a topical cosmetic or cosmeceutical, as they call them, because it does supposedly have some sort of medical benefit. They're just not claiming it's a medication, so they don't get hammered by talking about it and things like this. It's all planned by PR marketing firms, and that's all there is to it. But today is a special day because this is the first, I won't say legitimate, but it's the first hair loss product that's been released to target androgenic alopecia in a very long time. And there might be something to it. We don't know. You look at their website and what happened to it? Yeah, the results that they show, like when you click on, was it shop? Yeah, when you shop, it says results that you can see, start seeing the results within weeks. And you can't click on these 3 results that are sitting here. They are improvements, for sure. Not crazy improvements, but they're there. And it doesn't...
Yeah, I mean, it's just like anything else, right? Like, I'm looking for something to maintain. And if it's another thing, like you said, the big 3, and somebody said a really good thing where they're like, surgery without medication is dumb. They're 100% correct. Yeah. I believe you should try medication first, see how it does. And then, medication does lots of things, right? You have shock loss, for example. Yeah. You have, I'm not saying it completely prevents shock loss, but it helps mitigate shock loss. Like you're going to, versus somebody that's, prone to hair loss, you get a transplant, your native hair is likely to be affected by it somewhat. So using some kind of medication.
It doesn't really stave off shock loss unless you have been on the medication long enough to where any miniaturized hairs that would be more easily susceptible to the trauma of surgery are thickened and they're more terminal. But it does not have any effect on temporary shock loss. And when I say, and just to make sure that the listeners understand this, the way that shock loss happens, there's a couple of types of shock loss. There's temporary and there's permanent. And permanent shock loss can be caused by simply the disruption of blood flow affecting weaker hairs that are being miniaturized, and it can also occur from transection, physical damage to the neighboring hairs as incisions are made into the scalp. Temporary shock loss is also due to the disruption of blood flow from a surgery, but not from transection. It's not a physical response. So it can stave off shock loss, permanent shock loss, if the hairs are stronger because of the medication. So that's one scenario where it can work. But I always caution people when they're saying this, because I want to make sure that the information that gets out there when you're saying this is clarified and expounded on, so that all the situations that it can happen are also known, if that makes sense. So I just want to throw that in there. But how long ago did you have your second surgery?
Second surgery is very recent.
Okay.
It was 2 weeks ago.
Okay. Oh, wow. All right. And
so very, you want to say very recent and very recent.
Yeah,
it was another very minimal surgery. I guess now to have like an outside, not to get off topic, I know you want to talk about that, but as far as like my previous surgery, I saw a lot of pink and redness. Like, I'm not really seeing that now. Is that a good or bad thing, or does it really matter?
You're not seeing redness at this time, but you were right after surgery?
No. The first surgery I had, I did see a lot of redness,
okay.
After the shedding. This time around, I'm not really seeing any redness at all. But I don't know if it's too early for that, and I can't remember because it's been a while.
What's the difference in the surgeries? Is there a difference in surgery size?
Very close. This one's smaller. This one's a lot smaller. I think This one's only like 6 or 7 FUEs, and the original surgery was around 1,000. They were still, like I said, both very small, minimal surgery. I still have a full head of hair. I'm just trying to mitigate, trying to keep the hairline looking as normal as possible.
Were the grafts spread out more in the previous surgery, or were they more concentrated?
It's across the hairline, like this time.
Okay.
It's just like, the original surgery, I think I slowly over time I've lost some of my native hair, so I was trying to keep it as, as full as possible without, killing my donor area.
Right. Okay. Well, the fact of the matter is you had, relatively speaking, a significantly lower amount of grafts placed, so that could be it. Yep. Like 1,000 grafts in and of itself is not a lot. So if you got say 40% less in this surgery, then that could very well be the reason why you don't have much redness.
Yeah, I don't have any redness at all, hardly.
Yeah. Good.
I'm just hoping that's not a bad thing. I talked to Mr. Lee today, and he was like, it just really depends. So he's like, some people see redness, some people don't. Yeah. Like, it just I just want to make sure that's not indicative of it failing, of the hair transplant failing for some reason.
Not at all. Not at all.
Okay.
Not at all.
Okay.
Don't worry about that. Count yourself lucky. A lot of times people don't have a lot of redness after surgery. It just depends on the size, and it could also be maybe they changed the type of tool that they were using to make incisions.
I know what kind of tool he used. He used a WAW. Do you know what that is?
Yes, but those are extractions. You're talking about the placement, right? Like where the grafts are placed. Yeah, that's different. The WAW is technically the WAW is a machine, and it could be any kind of punch on the end. He's probably using a trumpet punch, and that's for your donor area. But the placement of the grafts could be different, where he might have been using, say, just throwing this out there, he could have been using a needle for pre-made incisions on your first surgery, and say he's using a blade of some sort for incision making on your second surgery, or maybe he's got a different post-op protocol where maybe he's spraying the area with I forgot the name of it, with a treatment after surgery. Oh gosh, I can't I'm having blankouts today. Anyway, it could be a different protocol for the surgery now compared to your first surgery with him. So it could be. Well,
I definitely go into a better clinic, I would think, this time, because I honestly went with these guys because I've watched your channel for somewhat a good bit of time.
Mm-hmm. Thank you.
And of course, man. And you made up a lot of good points, which I got very lucky with my first hair transplant, because it actually came out pretty good.
Oh, so you went to a different clinic before Anderson's?
I did.
Okay.
I sure did.
Got it.
And if I went to the clinic, is it okay to tell you what clinic I went to? Does that matter?
No, not at all.
Okay. Yeah, I went to HRS. Have you heard of them?
HRS, is that the one in Mexico?
No, they're here in Atlanta. They're based out of Atlanta.
Those guys. Yeah, where the consultant / owner likes to ride around on Harleys in videos. I think, is that him?
Probably.
Yeah.
It's apparently he basically a glorified salesman. He doesn't do the procedure. I want to say another doctor did, but it wasn't him. And
that's fine.
And they had the little assistants that helped, right? But I've just heard horror stories. Not. I don't like to shame anybody, but I'm just going by what people have said. My personal experience is not that, but people say
that's what matters. Is your personal experience. You said it was fine, and that's good. But then you decided to are you one of those guys that does research after you have surgery and then realize, maybe I should have gone someplace else?
Well, I didn't really know much because I was young and dumb. Yeah, and kind of like the gentleman was on the phone earlier. He was like, I just want to get this, and I don't care about, pre-op treatment. And I didn't really know much.
Yeah.
It's not that I know a ton now. Like when I went into Dr. Lee's office, he was like, man, he's like, you do more than I do.
Yeah.
Because, I do everything. I do finasteride, dutasteride, Rogaine, multivitamins, LRP, PRP.
You know a lot more now because you're a subscriber to the Hair Transplant channel. Isn't that right?
Yeah, that's right, man.
And there you go.
But and I'm just trying to, I'd love to add this to the arsenal. I mean, what do you think about it?
About which?
About the thing that you're talking about today. What do you think about
I'm actually reserving judgment because I don't have an opinion at this point because they made it this far, and it's like, why not just wait and let us see what happens to other people? Like, yeah, I don't know if you heard this before, but
would be hold off 6 months and see what happens.
Yeah, exactly. Hold off. Let's see how this pans out. There's zero reason to be on the bandwagon of being a first in line kind of guy. There's no benefit to that,
right?
Because it could just as easy go south. Like you have no idea how you're going to react to this. Let other people be the guinea pig, and meanwhile, stick with the tried and true stuff that we know is likely to help. And if this looks like something that is as good, or maybe even fingers crossed better, like I'm giving this like fingers crossed. I'm hoping it succeeds due to legitimate, quantifiable results.
I mean, it seems like it would complement the other medications greatly. I don't think it'd be a wonder-all treatment, but if the other treatments reduce DHT and this is reducing the tandis of the receptors to DHT, so it just seems like it'd be a combo deal. You know what I mean? Just like all the other treatments.
On the surface, yeah, it does make sense. It does seem like that would be a logical assumption, or at the very least, a logical hope. Not out of the realm of possibilities, but we don't know. So I mean, my opinion is let's sit back and wait. Let's see what look at Reddit. Like I'm sure there's gonna be a lot of stuff on Reddit, but more importantly, let's watch hairlosscure2020.com. I'm a big believer in that website. I'm a big believer in the guy that runs it. I not just because he supports this channel and things that I do. I believe that he's in the know on this stuff. Like he's always looking at this. That's what his website's based on. So let's all pay attention. Let's all bookmark hairlosscure2020.com and keep checking back, because that's the place to go to get legitimate updates on the efficacy of this. When people start talking about it and people start putting their results on there, he'll be updating, saying, okay, it looks like it's got some efficacy to it. There's something to it, and this is what we're seeing. So, yeah, he actually says in the chat room.
Okay, so there'll be a lot of like people.
Targeting. Sorry, I'm just reading something. Yeah. He was. Thanks. Also, read their study in Nature. Yeah. There's a study in Nature magazine. So anyway, go to that website, check it out for updates. That's what I got to say.
Yeah, definitely. Definitely, will do. Thank you.
All right. Well, Nick, thanks for calling. Good luck with your latest surgery. I wish you all the best, and feel free to call back anytime. Okay.
Yeah, absolutely, man. Thank you so much.
All right. Thanks, Nick. Take care. All right. Toll free 833-563-4247. That's 833-563-4247. If you want me to repeat it, just look at the number down here in the corner of your screen if you're watching this, not listening to this. I appreciate Nick calling. That was a great call. Anyone else can call in. You got opinions, maybe inside information about CosmeRNA, then let us know. Give us a call. Or if you want to talk about anything else, that's fine. This isn't just going to be about CosmeRNA. We're here to talk about anything and everything hair loss, and my favorite subject, hair transplant surgery. Give me a call. In the meantime, let's check the chat room, see what's going on. Talking about the big three again. Yes, Milk Drinker, I know that you're joking. I was joking as well. Let's see. Bertabon, why not use finasteride? Okay, that's a discussion between some people. Let's see. It's a little retro, passe, but I tried. Okay, so yeah. Looking for actual questions. Anyone, you got any questions? Hit the like button, by the way. Show me that you appreciate I'm here. 2 hours in the middle of my day. Can you believe that? 2 hours from 3 to 5. If I'm getting phone calls. If I'm not getting phone calls at 833-563-4247, I will be shutting down. I'm not here just to answer questions in the chat room, although I will answer a few. You just got to give me some questions. Let's see. Is it possible, Milk Drinker, is it possible to distinguish between the fine hair and the miniaturizing hair for hairline and temple point work? That, my friend, is a very good question. I do not believe that there is. The one way that you can tell, actually, is if a lot of the hair in a specific area are also miniaturized, because it doesn't make sense that if you have a field of miniaturized hairs that they're simply coming back into anagen. Did I read that right? Let's see. Yeah. Just fine hair. Yeah. If it's fine hair, then they'll be in the typical places that you'll find fine hair. But I've not had anyone explain to me how, say if you're looking at the donor area, if you can see a fine hair and tell if that's being miniaturized or if it's coming back in from a telogen state back into anagen. No one's been able to explain that to me. But if the fine hair is in a space that you'll typically find fine hair, like a temple or the nape or above the ears, then it's typically going to be just a fine hair. So I hope that helps. You say my audio keeps cutting out. Is anyone else having that problem? Is my audio cutting out for anyone? My signal is fantastic. Let's see, stream health is excellent. Don't know why. Brotherbond 60, Joe, what the hell is a trichologist? That's a good question. A trichologist. Oh boy, I need to be nice because I know some trichologists. A trichologist is not a doctor. A trichologist has not been to medical school. A trichologist has not been to, well, by definition, they don't need to go to medical school. It doesn't mean that they haven't been to medical school because a doctor might want to be a trichologist for some reason. But a trichologist is someone that in some places has gone to school and has received a certificate in the diagnosis and treatment of hair loss through non-prescription and non-surgical means. I just came up with that off the top of my head. I think it makes sense. I hope that is understandable. because a trichologist is not a doctor. I don't know. They can't write prescriptions or anything like that, but they do have. I don't know what the curriculum is for trichologists. I was actually thinking about investigating that further, but they will typically have a greater understanding of hair loss than the average person, simply because of their chosen field, but they are not doctors. That needs to be made very clear. They're not nurses. They're not physician's assistants. They're not nurse practitioners. Nothing remotely like that. But they will also typically recommend a more holistic approach, or some will recommend a holistic approach to hair loss through like elimination diets and some supplements. But again, it's all non-prescription stuff. So just want to make sure that's clear. Lars Rye Jeppesen, a quack, in other words? No, I don't want to say they're quacks. Like if I decided to go through a trichologist course or program and come out on the other end with a certificate that says I'm now a trichologist, would I then be a quack? Like maybe I'll do that just to show that I can get through it, and I can wear a lab coat and say I'm a trichologist, and a lot of people will be like, oh, well, that means something. You know, I don't know. What do you guys think? Should I become a trichologist? Add some credibility? If you think that adds credibility, let me know. Let me know in the comments section down below if you're watching this after the live stream, or in the chat room now if you're watching now. It'd be, yeah, holistic approach is a euphemism for doesn't really work. In many cases, that's true. Let's see. Oh, FSK. No. Don't go there. Be nice. Anyway, toll free 833-563-4247. I'm going to wind this down. It's 19 minutes past the hour, 4 p.m. Pacific time. I'm going to wind down if I don't get a call in a couple of minutes. It's been fun. It's been a great subject. There have been some good questions, and I've had some good calls. I want some more calls, but I will shut down if I don't get one in 1 minute. You got 1 minute for someone. Boy, that was fast. Okay, here we go. That was nice. Hey, you're on the main event. What's your name? Where are you calling from?
Hello, Joe. It's Norwood Shaman here.
Norwood Shaman. Was that you before that called?
No, that wasn't me. That was somebody else.
Okay, because he kind of sounded like you. I wasn't sure, and then when I asked him to clarify, he got the jitters and hung up.
Oh, okay. Now I can assure you that wasn't me.
I think, Norwood Shaman, you have an impersonator out there.
Maybe so. Or maybe I am impersonating him.
Or maybe.
You never know.
You son of a bitch. You so clever on that one. What's going on, my friend?
So, I have a few questions.
Okay.
Firstly, I would like to ask you about, oral minoxidil and finasteride work in different ways, right? But still, one of oral minoxidil's side effects is gynecomastia. And, when you use finasteride, the testosterone becomes free testosterone, right? It releases. So the abundance of the free testosterone aromatizes, right?
Yes.
And becomes into estrogen, and that's why you get gynecomastia. But I don't understand why oral minoxidil gives you gynecomastia.
I don't either.
Okay.
I don't either. You know, what's funny is when I first discovered minoxidil in 1997, I think, 96 or 97, I was living out of state, and I was working at a place where appearances were important, and my hair was already destroyed. But I thought, well, why not give this a shot? And I didn't remember if this is actually what I'd read, but then I remembered recently it is what I read. I was reading the side effects listed on the box. I don't know if they're listed now, but on the actual original Rogaine box that you would get in 1997, gynecomastia was one of the stated side effects. And that's when I put the box down with a big nope. That's what scared me.
Yeah.
I've been taking it maybe 6 weeks. Like, I already didn't like it because it was greasy. You know, the original Rogaine was not fun. It was greasy. I didn't have any side effects that I recall, like hypertension. Like, I didn't have accelerated heart rate. I didn't have skin breakouts. I didn't have scalp issues. I also didn't have gyno, but after 6 weeks of taking it, that's what made me put the box down with a big nope. Nope. And I never looked back. I don't know why that's the case. I never looked into it, but I don't, is it actually like real gyno where the gland itself is enlarging, or is it through water retention? Like, does it aesthetically look like gyno? I don't know. It's probably actual gyno for, that's why they're listing it, but I don't know. I've never looked into the mechanism on why that happens, so I can't answer that question.
Okay, but have you seen any long-term studies on health effects on oral minoxidil?
No, because there are none that I'm aware of.
Yeah. And this is something that actually concerns me because, people, especially in the hair loss community, they are quick to jump on any kind of medication that is, that they say is prevents hair loss without it going through the trials and, stuff like that, and the studies on it. So that is actually a bit concerning that people are so desperate. It's understandable. I totally understand it. But people, in my opinion, they are gambling with their long-term health.
Well, yeah, I think you're right. But I think that, when we've had a medication around as long as we've had finasteride, as long as we've had minoxidil in oral form, I think that at this point, if there were any obvious long-term issues, I don't think we'd need studies to let us know this. I think people would be, for lack of a better, dropping like flies if it were an actual issue. I could be wrong, but that's just logic for me. And when I say that there's no long-term studies, I mean I don't know if there's long-term studies for the original dosage of 10 milligrams, but there's no long-term studies for what some people mistakenly refer to as microdosing at 2.5. It's not really microdosing, but some people would talk about it like that. But there's no long-term studies on that. There might be on the larger dose at 10 milligrams. I just don't know. In fact, there probably is, only because it has been around for so long, and like there are long-term studies with finasteride. So it would make sense. Maybe there is. Like, I misspoke. I was talking about the lower dosage. There probably is with the larger dosage. Hair Loss Cure 2020, can you back me up on that in the chat room? I think there is.
Yeah, because I've been looking like crazy for any studies, on long-term effects regarding oral minoxidil, because I have been very interested in actually jumping on it, but I am too afraid at the moment, just because there are no studies. And what was I going to say? Yeah. And let's say that you use oral minoxidil, and hairs on your hands, arms, shoulders, they thicken, right?
Yeah.
What if you would jump off it later? Let's say in about 10 years. Would that hair be weakened again to its original state, or?
Absolutely. Just like I was talking to the first caller, if you were to take any treatment and it reversed your hair loss to any degree, or even maintained it to any degree, and then you got off the medication and there was no degradation, there was no reversal into the negative, then that would not be a treatment, that would be a cure. Even if it's not, a full head of hair, like if you just maintain where you are, after hair loss began, and then you stop taking it, that would be a type of a cure, because you stopped it permanently and you don't have to take it any longer. Right? I always fall back on that brushing your teeth analogy, the toothpaste analogy. Toothpaste is not a cure for tooth decay. It's a treatment. You know, fluoride is a treatment. It's not a cure. You have to use it every day to keep your teeth. And even then it's not 100% effective. People still get gum disease if they're not brushing properly. You know, like, I'm not going to go into the whole thing, but you understand the point. So yeah, doesn't matter how long you take it. If you stop taking it, you'll lose. In fact, once you start losing, it'll seem like it's accelerated, because you usually will lose everything that you'd held on to had you not been taking it to begin with. So it seems like it's accelerated.
Yeah, because as you maybe remember, a couple of days ago when I called, I told you that I was on topical minoxidil about 15 years ago, and then I stopped, and that topical minoxidil actually turned me into a werewolf. I got hairs coming out of my ears, and I got a Persian carpet on my back right now. So, it doesn't. So that is irreversible. But
that's reversible. That's actually somewhat reversible with finasteride.
Yeah, that's true.
Yeah,
but then you run the risk of actually thinning your beard as well.
I've not seen that, actually. I've not seen anyone claim that their beard got lesser after taking finasteride. I could be, I'm not saying that it doesn't happen, but I've never seen that. I've never seen anyone claim that. The only thing I've seen claim, in fact, doctors I know personally have told me that after they started taking finasteride, their back hair reduced, or even their chest hair reduced, which I think is extreme, but it happened more than once, more than one case. So it's interesting. I've never heard the beard thing. Like, logically, sure, follow that line, it would make sense, but in practice, I've never had anyone tell me that was the case for them. Again, not saying it doesn't happen.
Yeah, and you have had over 20 years of experience, right?
Mm-hmm. Yep.
Okay. So regarding another subject, I want to ask you about consulting. I actually sent a few pics to a clinic the other day, and they told me that my donor area was looking good.
Okay, good.
And I was wondering, how can they spot that, just from taking a picture from the back, straight from the back. And I was thinking, how can they know that? Because they don't see, the microscopic details and stuff like that. And it's not only one doctor that has said I have good or average density. Some have said that I don't have good density. That was when my head was shaved about 1 millimeter, but now I have actually grown it out just to take a look at how it looks. So it looks fuller now. But so I want your opinion on that. Can doctors or surgeons see just from looking at pictures straight from the back?
Yes.
If the donor area is sparse or good?
I can. I did it for years. Now, so let's address a couple of the points that you said. So the fact of the matter is, no one can tell that you have a good donor from photos when your hair is buzzed to 1 mil. So that's why the clinic, I don't even know why they tried, because anytime I would get, as a consultant, I would get photos of a patient and their head was buzzed, I'd tell them, get back to me in a month or 2 months when your hair's grown out long enough to actually give, where we can give a proper assessment. I'm not going to waste my time, because anything that we tell you could be completely off base, and we won't know until the day of surgery. So get back to me when your hair's grown out some. I'm going to say something that will be controversial, but I don't care. The idea that you need some sort of scope to determine if a donor is viable is horseshit.
That was actually my next question.
Let me finish. Hang on. So there are caveats, obviously. If you do have a situation where there's a scalp condition, an underlying scalp condition where you can't see it in photos, obviously that is a exception to the rule. If the photos are of poor quality, which happens, when I was a consultant, I was very strict on photos. Some people would say, "I'm not wasting my time with you. You keep asking me to send more photos. What more do you want?" And my response would be, "Wipe the frickin' Vaseline off of your lens because it looks fuzzy. Like, are you looking at the same pictures I'm looking at? Because I can't see individual hairs. I just see a blob, on your scalp, like relatively speaking." So I was picky about photos, but there's a reason. It's because we can't tell if the photos aren't any good, and that's just a fact. But if the photos are good, and the patient would follow instructions, like typically there would also be a requirement to lift the hair.
Yeah.
With the, I would actually have patients lift the hair with the handle with the handle of a comb, not the comb itself, but if you have a rat tail comb, or some sort of even a chopstick would work, some sort of narrow tool that you can use to slide along the base of the hair at the scalp and lift up a line of hair so you can see the part line of hair in the donor area.
Work?
That's what allows us to see density. I'm sorry, what was the question?
Wouldn't a finger work?
It can, but it's difficult to get a straight line with a finger. We want to see, where I want to see a straight line to where it's like a part line going horizontally across the back of your scalp, or up the side of your scalp too, on above the ears, because I would ask for I call them density photos above the ears. And I used to have a visual guide, a visual aid I would send to patients that would show them exactly what I need and where, because on every patient, especially above the ears, even if patients have retrograde alopecia, there's a very specific area that is always denser than above or below. Yeah. And that's what, I've referred to, and what Spencer has referred to as the sweet spot. Keep in mind, I was talking about strip surgery back then. So, that's why I was looking for those areas. But yeah, back to the point, scopes are not necessary for even a good diagnosis. They do help, but they're not necessary. So I think that if they're valuable because they do help you find, quirks or, underlying conditions or things that may make you think, okay, well, maybe we shouldn't do this or do that. But for the vast majority of patients, no, they're not necessary. I have looked at so many I've 50,000 plus consultations in my career. I think a lot more than that. And scopes weren't used.
Because I remember when I went to a consultant, or a nurse actually. She was a nurse. She was, taking a look at it. This was 15 years ago. She wanted to take a look at my scalp to prescribe me finasteride. So she took a look using this scope, and it was a screen where you could see everything in very high detail.
Yeah.
And today's phones are actually have very good cameras, and I have noticed that I can actually take similar pictures on my phone with my camera.
Yeah,
like you can on the scope with the scopes. So
there are attachments you can order, you can buy, that are actually they're very high quality. They improve your camera phone. They're usually designed for iPhones because that's a set standard that is easier to manufacture for. and they're very high quality, and with the USB connection, they can connect to a computer to show on the screen as well.
Exactly.
But
and they only cost about $20.
Well, the ones I'm talking about have very high quality optics, like Zeiss optics and things like that, and they're a couple $100. But still, yeah, you're right. Like you can buy macro lenses for an iPhone or for an Android phone, for that matter, for $15-20 all day long from lots of companies. But the point being is, the cameras are great, but I look at scopes and then having the screen in front of the patient so that you can both look at the hair. In many cases, I consider that to be a gimmick to make the patient feel. And what I mean by gimmick is, I mean a sales gimmick to impress upon the patient that you really know what the hell you're doing.
Exactly.
Remember that most hair transplant surgeons are not dermatologists, so they're not going to be able to. They don't have that kind of background. They may know what they're looking at, but they don't have that kind of background. But I equate the use of scopes with screens in front of the patient so that the doctor and patient can both look to the pull test, the hair pull test that some places would use to tell you that the sebum that's at the base of your hair is actually clogging your follicles and preventing it from growing. It's a very old sales tactic in this industry where this guy that's not a doctor, it's not anything, but he wears a white lab coat, which is part of the presentation. He'd pluck your hair and he'd stick it onto a piece of glass and then slide it under one of those old school slide projectors, or not even a microscope. What do you call those
overhead panel?
Overhead projector. That's what I'm thinking of. Like old school, right?
Yeah.
Like the kind that the teacher would roll out for us in grade school to watch a presentation, one of those. And you could see the base of the hair, and there's always like a little bulb and a little piece of dermal tissue around it, and they'd say that's sebum that's clogging your follicle. This is why you need to buy this $300 shampoo every month or every 2 months or whatever. I look at it as the same thing, because it's not necessary in most cases. So I've spoken. That's my position on that.
Okay. Yeah, well, I got all the information I needed today. So thank you, Joe.
All right, my pleasure.
I'll catch you tomorrow, tuning into the show.
All right, I appreciate your call, and you have yourself a great day. Thanks for calling.
Okay, you too. Take care.
Bye-bye. 1-833-563-4247. It's toll-free in North America. Give me a call. Let's talk CosmeRNA or anything else related to hair loss and hair restoration. The Norwood Shaman, I like his calls. He's informed, and he's got good questions. So what questions do you have? Let me know. Give me a call. In the chat room, Joe School. Yep. That's Rob. Hey, Rob. Let's see. Didn't this caller state 3 shows ago that he's a Norwood 7? I think he did. Or I think he said 6/7 in there somewhere, which is where I used to be, or where I am without my surgery. Let's see. Lars Raya Jeppesen. Fun fact, 90% of people are told they have donor above average when visiting a clinic or clinics. I wouldn't say it's a fact, but a lot of people are told that. Sometimes legitimately. I've told people that, thinking that legitimately, and they show up and I got stories of people flying halfway around the world for surgery, and then we send them home because their photos, while they looked fantastic, were highly mistaken, highly misrepresentative of the facts. I'll just say that. And it boggled our mind. Actually, it boggled my mind, because I thought it still looked pretty good. Doctors still sent him home. But anyway, I digress. Hey, Joe, great show again as always. Thank you, Rob. I appreciate that. You could call sometime. It'd be nice. Let's see. Anything else in the chat? I don't see any questions. Just some nice comments. I love that you guys have your own banter back and forth. It's nice. Yeah, you called Friday. Is today Friday? No. Wednesday. I'm giving you a hard time. I appreciate you and your support. toll free, 1-833-563-4247. We are now coming up on 1 minute. If I don't get a call, I'm shutting her down. We're coming up on 5 o'clock anyway, so it's no big deal. But yeah, we got 1 minute or just less than a minute. I will shut down if I don't get any calls. I do appreciate everyone in the chat room. I do appreciate the previous calls we've gotten. It is an interesting subject. CosmeRNA, is it the newest hair loss savior? I'm not going to say a cure because we know it's not a cure. Or is it another bottle of snake oil? I don't know. I hope it's the former. I really do. Like I would love to see another contender that's legitimate. I'm tired of talking about finasteride. I'm tired of talking about minoxidil. Not so much minoxidil, because oral minoxidil is kind of a new thing as far as discussions go, relatively speaking. But I got to tell you, guys, when I was a consultant, one of the things I dreaded every morning the last few years I was working was phone calls where patients would call in, or prospective patients would call in, and when I would start talking to them about preventative medication, it was always about what they heard. You know, they're not taking it because they heard this, they heard that, they read this, they read that, and it doesn't bother me so much now. It's not a big deal to me now, but man, I was burnt the F out talking about finasteride. Hated it. I knew when it was coming up before it would actually leave the person's mouth. I knew they were going to ask me about finasteride. Not so much ask, but state why they didn't want to take it and not understand why surgery was a bad idea without it. Whew, I hated it so much. And that's part of the reason why not why I wouldn't be I wouldn't do consulting now, which I don't really do for people. I do in some situations when they pay me a lot of money. I'm kidding. I don't take money for consultations. But that, I would never be a consultant again working in a clinic. Never say never, but I would never go back to that. And that is one of the reasons why. Because I know I'd blow my brains out if I had to talk about finasteride on the phone to another guy again, because that's the way I felt. Anyway, just a little bit of a rant from my past and how I felt about things. Hampton Hudson, my man. Joe, you said you put minoxidil down because of gyno being a potential side. Yes, I did. I'm confused because we all know finasteride is known to cause gyno in some folks, not minoxidil. Don't be confused, my friend. It was before research was even a thing for me. The internet was barely there. This was actually when I was really getting into building computers and AOL and CompuServe and all that. Like I have a long hardware background, and that's when I was first getting into systems and started learning about it. But I actually read it on the box after I first started taking it and put it down. Didn't go back to any sort of treatments again for 4 years. 5 years. For 5 years, I didn't touch anything. 5 years later, I was in Dr. Wong's chair, and he talked to me about finasteride and or Proscar specifically, and that's when I started taking it. And we did talk about side effects, and he told me actually we didn't. No, I take that back. I don't want to misrepresent my early days. We did not talk about it because I didn't know about it. I didn't know about side effects. I just trusted Dr. Wong. I said, yeah, sure. Well, I'll take that. If you say it'll save my hair, what I have left, that's important. That's all that mattered to me. And then I learned about them later, and I was like, yeah, I'm not getting that. Been taking it for however long I was taking it. If I'm not going to get man boobs by now, I'm not getting them. And that was true. But I'd only been taking it for 6 weeks at that time, and I had zero experience with hair loss as far as understanding things. I had zero knowledge about treatments, and so it's easy. That's why I understand it's easy to get scared about this stuff, and it scared me. It was a big nope for me. Now I know better. Yeah, okay. So we've gone way past that minute. So I'm going to wrap things up. I appreciate everyone's calls. Again, everyone, thank you for being in the chat room and listening. If you're listening to the podcast, watching, if you're watching the live stream here on the Hair Transplant channel on YouTube, I will be back tomorrow with a special guest. Same time. She said we don't have to do early. She's going to get up 1 a.m. for her. Sorry for her patient the next day. Just kidding. Dr. Ujlan Bisher. She is an IAHRS accepted member. She is a hair transplant mentor doctor. I have been to her clinic. I've spoken to a lot of her patients, and I like her. She's good people, and I'm looking forward to having her on the show. You guys will be able to ask her questions. I will make sure the phones are set up properly. And I hope you guys appreciate that I'm bringing on these guests that you are not finding anywhere else. I don't think Dr. Bisher has been on any... Well, I know maybe she has. I don't know. But yeah, you don't get this anywhere else. All the doctors I brought on, Dr. Cole, Dr. Nussbaum, Dr. Cooley, Dr. Yaker. I know you've not seen Dr. Yaker before. And now Dr. Bisher, and more to come. And not just hair transplant doctors. I am in talks to get some non-hair transplant doctors, some specialists in the room for you guys so you can ask them questions yourself. What better way to get information than straight from the horse's mouth? You guys take care. Have yourself a great evening, and we'll see you tomorrow.